What do you think? They're just gonna face plant and bust it open anyway.
Pediatric dentist here. I don't talk too much about lip ties and tongue ties, a very controversial topic in the land of pediatric dentistry, ENTs, SLPs, everywhere. Super controversial, but I did not appreciate the portrayal of the provider in this instance, the pediatrician or the dentist. So here I am. Let me give you a little backstory. I have worked in a high volume tongue tie release clinic. My eldest two kids had lip tie release and tongue tie release themselves, and I've had my own tongue released by a laser. So I have some experience. What wasn't shared was the fact that lip tie diagnosis is highly controversial. Did you know that the AAP, the AAPD, and the AAO, and the American Academy of Breastfeeding Medicine, none of them recognize it as a diagnosis? The Cotlow scales and these various scales that are used to assess them, they don't even account for normal. There is no part on the scale to label it as normal. There's just grading 1, 2, 3, 4. And then beyond that, the grading is not associated with a clinical outcome, saying, oh, it impacts gassiness, they have to be able to evert their lip. Did you know that's new? That used to not be part of IBCLC training? Not until Cotlow got involved and started speaking to IBCLC group. And then suddenly in like 2013, lip eversion and lip ties became a big thing, and it's part of like IBCLC training now. Another fun fact, did you know that a nurse in an IBCLC, generally in most states, is beyond their scope of practice to diagnose tethered oral tissues like a tongue tie or lip tie? They can assess for function, they can refer to a provider, but they're not supposed to be diagnosing them. Another fun fact, that IBCLCs, SLPs, some of these folks have kickbacks in certain states because that has not been addressed yet, morally, legally, whatever you want to call it. They're getting kickbacks for referring you to a surgical provider like a pediatric dentist that's doing a lot of these. And you want to know how much cash pay a lot of these are because they're not covered by insurance. $500 per tie. They're finding new ties. Buccal ties, cheek ones, that's new. They've added that on. Also not recognized by any of those academies. So in my opinion, the only one that's even remotely legit is a tongue tie release. There are kids with tethered tongue tissue. Do they need this big, giant, painful wound under the tongue that's the diamond shape? No studies show that's beneficial. And then you're getting a wound that has to heal by secondary intention. And then you get re-scarring down. You're doing these exercises, which they're going back and forth about whether or not you need them or not, because it can lead to, let's talk about the consequences, because usually they're like, oh, it's so easy. It's just a little laser procedure. So simple. Then you have kids that become failure to thrive after these procedures. They have intense pain and oral aversion after the fact. The parents are trying to do these exercises they're told they need, but it's not really clear if they really need them. There's also expensive myofunctional therapy now being recommended afterward. I'm ranting, but we're not telling people they don't need lip ties addressed because they're just going to fall and tear them. Yes, it's common for kids between 18 months and 3 to fall and tear this tissue because it's often prominent in kids. Most children have grade 4. That doesn't mean they have bad function. We don't want people to be getting scammed and talked into surgeries that they don't need.